Republican frontrunner Mitt Romney's presidential campaign is in trouble, deep trouble, before it even officially begins. Today, the Wall Street Journal attacked the former one-term governor of Massachusetts on his most vulnerable issue in a Republican presidential primary. In a lead editorial on the most influential editorial page in Republican politics, the Journal said, quote, "As everyone knows, the health reform Mr. Romney passed in 2006 as Massachusetts governor was the prototype for President Obama's version and gave national health care a huge political boost. The debate over Obamacare and the larger entitlement state may be the central question of the 2012 election. On that question, Mr. Romney is compromised and not credible. If he does not change his message, he might as well try to knock off Joe Biden and get on the Obama ticket." In a surely hopeless attempt to turn his worst liability into an asset for Republicans, Romney went to the University of Michigan, Ann Arbor, to deliver a major address about the health care plan he supported and signed as governor of Massachusetts in 2006, and why, as president, he would want to repeal the health care reform that President Obama modeled on Romney's plan and signed into law. At minimum, Romney seems to be hoping to score political points simply by being brave enough to talk about the issue at all.
I should note, by the way, that was a time when my Massachusetts health care plan was considered, at least by me, to be an asset politically. I hear some laughter in the room. That's not the case now. But you will note that despite the fact it's gone from being seen as an asset to being seen as a liability politically, that the plan I'm going to describe for you is the same. I'm not adjusting the plan to reflect the sentiment, the political sentiment. And I respect the views of those who think that we took the wrong course and who think we should have taken a different course. I also recognize that a lot of pundits around the nation are saying that I should just stand up and say this whole thing was a mistake, that it was just a boneheaded idea, and I should just admit it. It was a mistake and walk away from it. And I presume that a lot of folks would conclude that if I did that, that'd be good for me politically. But there's only one problem with that. It wouldn't be honest. I, in fact, did what I believed was right for the people of my state.
Romney went on to discuss his idea for repealing and replacing the Obama health care reform law, apparently not having noticed that Washington Republicans have shifted positions from repeal and replace to repeal and good riddance to the health care reform.
I'm going to talk today about repealing and replacing President Obama's health care system. And I know that some people, when I talk about doing that, say, wait a second, I've heard that your plan in Massachusetts is an awful lot like President Obama's plan. And so why is it that you're so anxious to repeal his plan and replace it with something else if it's so much like what you did? Our plan was a state solution to a state problem. And his is a power grab by the federal government to put in place a one-size-fits-all plan across the nation.
Joining me now is the Democratic governor of Massachusetts, Deval Patrick. Thanks for joining me tonight, Governor.
I'm glad to be with you, Lawrence. Thank you for having me.
Governor, was the Wall Street Journal right today when they said, as everyone knows, the health reform Mr. Romney passed in 2006 as Massachusetts governor was the prototype for President Obama's version and gave national health care a huge political boost?
Well, he's certainly right. They are certainly right at the Journal that our plan is a model for the national plan, the Affordable Care Act. They didn't mention, but I will, that we have now provided insurance to over 98% of our residents, over 99.8% of children. No other state can touch that. It's added all of 1% to state spending because we have managed it effectively and continue to adjust and refine it as we've gone along. More companies, private companies, are offering insurance to their employees today than did before the bill was signed into law. It's been a wild success. And we have ongoing challenges like the rest of the country in terms of insurance premiums. But just as we have shown the nation how to expand coverage to everyone, I think we will here be the place that cracks the code on cost containment.
Governor, I was listening a little bit today to Howie Carr's radio show, as you know, in Boston. I'm from Boston. I try to pick it up whenever I can. And the general consensus I picked up today was that these are conservative listeners to that show, as you know. They like Romney as a person. They always kind of liked him, but they just think this is absolutely impossible for him to get past his health care history in Massachusetts, now running for president. It's an interesting kind of quandary, as so many people see it, and apparently so does Howie Carr. First of all, I want to agree. Governor Romney has always been a gentleman to me, and I think of him fondly on a personal level. But to listen to him today, it sounds to me he likes most everything about the Affordable Care Act, except for the fact that the President of the United States, Barack Obama, is the one who signed it into law. Yeah, it was hard to find exactly what Romney would do differently if he was presiding over this same situation in Massachusetts today. He wasn't backtracking from what he did, and the individual mandate, which is the cornerstone of the Massachusetts bill, and the first real model we had for that in the country to think about how it might work, is the thing that Republicans object to the most. That's the thing that has driven Republicans to take the case, they hope, to the Supreme Court to rule the Obama bill unconstitutional. It's hard for me to see how he can get by the first debate of Republican candidates where everything he supported is absolutely something they all oppose. Well, you know, it's interesting. When the debate was happening here in Massachusetts 6 or 7 years ago, we just had the 5th anniversary of enactment. I remember personally being uneasy with the idea of the individual mandate. And as I listened to Governor Romney describe it at the time, and many of the business people who were supporting it, they said, look, this is a classic feature from insurance, that you spread the risk as broadly as possible in order to keep the cost down for everybody. And so I understand that, and as I say, it's been a wild success here. But I think there's a larger question here, and that's about what kind of country we want to live in. That's really what the underlying debate is. And I think the job of the president is to help people, not to solve every problem in everybody's life, Lawrence, but to help people help themselves. And what it sounds like is that Governor Romney wants to have that job but not do that job. Governor, my favorite political comment I've heard about this, I've actually heard it through Howie Carr's radio show, where they quote the mayor of Boston, Mayor Menino, who every once in a while will misspeak on a word or two, as having But he's a great guy. He has apparently said that Romney Care is an Alcatraz around his neck. Can you check that for me and find out if that's exactly the way he said it? The mayor is a wonderful guy and a great supporter of what we have done to help so many men, women, and children have the security of health insurance. And you know what? What a great thing to be able to assure our population during the worst economic downturn in living memory. Deval Patrick, Democratic governor of Massachusetts, proud of what Massachusetts has done with Mitt Romney's health care bill. Thanks for joining me tonight, Governor. Thank you, Lawrence. Be well.